Okay, now that we've talked about education, we have to talk about educating ourselves about systems, the bigger systems. Think big and get serious. And I see the isolated conversations of things like healthcare and food and obesity and cures for disease, and we're looking at these in isolation. We have to look at these together. All right, our food, medicine, and the fighting of our future relies on the innovation of the biomedical industry. Research and development of knowing the organisms and cells that are going to help bring us to a sustainable future where we can feed billions of people. All right? Our system right now, although it's meeting the problems, we're causing peripheral problems and dealing with crap responses. What I mean by that is our food system sets people up for failure in terms of diet. Diets high based in corn, based in soybean, fatty meats, and high in sugar, and it sends them into medical conditions requiring medications at an astounding rate. Astounding rate. About 1/3 of Americans have diabetes or pre-diabetes. The average American, 66% of Americans are on medication. The average American is on 4 medications. All of this, it results in about trillions of dollars in debt, healthcare, which we're taking out of debt, to pay for self-induced problems of obesity, diabetes, diet-related cholesterol. That's where our about 86% from chronic disease of our, what the hell is it called? Of our public healthcare spending. And that money is just towards obesity and maintaining disease. That's where we're at. Just maintaining it. We're not fixing it. And we're growing at such a big problem that we're going bankrupt because we're dealing with these problems. It increases by tens of thousands, millions of dollars, billions of dollars each year. The trajectory of education doesn't even compare to the bankrupting trajectory of our healthcare system. It's one of the biggest issues on any public budget. And the majority of that budget has to do with poor health decisions, which lead to obesity, diabetes, high cholesterol. All right? And we need to understand that our biomedical resources are being directed to fix those problems, which are self-induced. But if we can reduce those problems, like obesity and diabetes, if we understand where our food comes from, because people aren't trying to hurt people. The reason we produce so much corn, so much soybean, is because it sustains life. Look at us. We're doing a great job. They're not evil people, all right? But we need to understand. But to fix our problems, we need to realize that the biomedical and chemical industries are deeply involved at every step of our food system, from the genetically modified seeds that are resistant to droughts, that increase yields, to the antibiotics of the hundreds of millions of livestock that we go through every year, the pesticides, herbicides, fertilizers, preservatives, artificial flavorings, and the treatments for obesity and diabetes. This is all heavily involved in the biomedical industry. And that's precisely the industry we need to focus on to sustain our population. It has lots of problems. It has the peripheral problem of causing health problems. It has the peripheral problem of biomedical industry selling pharmaceuticals that don't help us and sustain problems. It's intertwined with the government subsidizing both the problem-causing foods and subsidizing the problem alleviating band-aids of medications. But we're not getting to the root causes of these. Not at all. But to get to the root causes, we need to understand how our food system got there. It's largely corn, largely soy, largely meats, because that's what we need to sustain our population. But we also need to focus on this because they're problematic. We can't just go off into the future without knowing what we're doing, which is why we need more people involved in the research of biomedical innovations in food, water, energy, and information. We need people prepared for these challenges because it's not simple. When I say food, water, energy, and information, it's not simple. It's really complex. I can't even deal with it. But to understand that, we need to know that our food system causes problems and our response is biomedical. And biomedical owns the food industries, and these are all overlapping. You need to look into this for yourself. I'm not saying that in a bad way, but just educate yourself. And our healthcare system's broken. We're on the trajectory of bankrupting ourselves. Our food system's broken. We're on the trajectory of killing ourselves by eating too much. But we need a direct answer. This is me. Woo! Holy shit. I'll drink this and you'll see the irony in a minute. I've gone over all the problems, I think. I've gone over a shit ton of problems. I've gone over, I hope, traces of solutions, of reforming education. Building a bullet train to help grow our state's economy, to stabilize an innovation hub that can help impact the world with its scientific developments and manufacturing capacities for specialized products. Like, we can kick ass. And then around that, we're going to build suburban capacity to double our state's capacity for around that hub, and we're going to be prepared. But then our healthcare, we need to take care of it. We keep talking about healthcare, but it's a broken system, no matter how you pay for it, or no matter what you do. Healthcare is a broken system. We can fix education. That's easy. Healthcare, we have sick people. But why do we have so many sick people? Our diets. You know what I mean? We have lots of diets and lack of exercise for whatever reason. And it's our largest budget issue. But I can talk all day about reforming and the benefits of whatever healthcare system you want. But that's not going to give us the result of improved public health. Improved public health comes from people being healthy, living healthy lifestyles, not poisoning themselves with food and energizing themselves and making themselves healthier with the exercise. It's not very hard. We need people in Massachusetts, all right? We can talk about healthcare, but to reduce the costs, we need less sick people. And we can get the less sick people by people prioritizing health. That's more exercise, better diet choices, all right? Better sleep. And that right there, if we have that in a large-scale aggregate, we're going to have an enormous impact on healthcare. I mentioned earlier about 100 million people with diabetes and prediabetes. That's more medications over longer times for the rest of their lives. Like, it ends up being an enormous cost burden. Now think about it. If we got in shape and we eliminated that burden, that's hundreds of millions of dollars, billions of dollars over years and years and years saved. All right? We need to prioritize diet and exercise. It's a simple solution. People need to care about themselves, all right? People can't care for you. We can have a government that wants to help you in every way with education, jobs, but we can't care for you. You need to care for yourself, all right? And you need to care for others. You don't want to be a burden, right? What are we going to take away from biomedical research into finding cures for childhood cancers? Or are we going to feed insulin to people who just want to keep eating cupcakes, right? We need to make that decision. We need to prioritize health in Massachusetts. We need to be leaders. It's not hard. Eat better food. Cook. It's yummy. All right? And I'm not being an asshole. I'm drinking beer right now, living a normal life. But we need to cut back on the processed sugars. If we cut back on processed sugars and worked out a little bit more in front of a TV, the aggregate collective impact of our healthcare industry, it would be mind-blowing. Save billions of dollars, money that could go for infrastructure, education, job training, that we're not wasting on diseases induced by cupcakes. We need to take responsibility for ourselves. I say a lot, but we need to have a system built on trust where our government's going to take care of us, but we need to make sure we're not being a burden. We need to be positive roles. It's not hard. And dude, I'm here. Let's just kick ass. What I'm saying is, let's take personal responsibility for ourselves and we can have a major impact. And that has a big role. Like I said, our big problems. Think big, get serious. We need to worry about population growth, economic decline, and climate change, all right? We don't need obesity and healthcare adding to those problems, all right? We need to fix real problems, and let's take personal responsibility for ourselves. Let's go out, let's educate ourselves on everything. Food, water, energy, and information. So am I talking out of my ass? Go look it up. I don't care. Email me questions. I'd love it. This is the best. I've had such a great time. I've had a couple beers. Dude, give me a call. This is awesome.